Well, Casey, I think my team and I can help you with that. Allow us to introduce ourselves. I'm Lindsay Green.
I'm Janan Sarwar.
I'm Ashley Hedges.
And I'm Jessie Kasberg. And by the end of the day, we hope that you'll be able to understand the description and the evidence behind using herbals, physical manipulations, and mental stimulation to treat headache, and how those compare and can be used with traditional medicine.
I'm going to cover some of the top herbal therapies available today. First is Feverfew. Feverfew is indicated for migraine prophylaxis. Migraines are caused by rapid constriction and dilation of blood vessels in the brain. Feverfew works by inhibiting constriction of the blood vessels, which can prevent a migraine from happening. Adverse events are generally mild, however, there has been evidence of oral inflammation and ulceration in patients who use Feverfew for more than 10 years, as well as withdrawal symptoms such as anxiety and muscle pain in chronic users who stopped using Feverfew abruptly. And an important note is that patients with an allergy to chrysanthemums, daisies, marigolds, or ragweed may have an allergic reaction to Feverfew. Feverfew has an evidence grade A. Next is Butterbur. Butterbur is also indicated for migraine prophylaxis. The way it works is thought to be by causing relaxation of vascular smooth muscle in the brain and reducing smooth muscle spasm, both of which can prevent the rapid constriction and dilation that causes migraines. An important note about Butterbur is that raw and processed leaves should not be taken because there are alkaloids in leaves that can cause hepatotoxicity. Butterbur is generally well tolerated as long as an alkaloid-free preparation is used, and like with Feverfew, it has similar cross-reactivity with other plants. Butterbur is evidence grade B, but a caveat to Butterbur therapy is that there haven't been any trials that have lasted longer than 4 months. Finally, topical peppermint is indicated for acute headache. It works by causing depolarization of cold-sensitive receptors in the skin and alters pain receptor sensitivity. This is a generally safe therapy, with the most common reactions being dermatologic in nature. Topical peppermint has a B rating. Here's a summary slide of all the available herbal therapies that have a headache indication and their evidence ratings. As far as the therapies I just discussed, they are generally safe and there is evidence that they could work. So we think these therapies could be used in a generally healthy patient as long as they use appropriate standardized products.
There are several different physical manipulations in alternative medicine. I will now show you a few examples. Chiropractic care relaxes tight muscles and realigns the spine to correct imbalances to stop the pain of headaches. The main goal is to improve vascular blood flow, and that's how it works. The reflex zone associated with the brain is located on the ball of both big toes. Using a special tool, reflexology massages the area about 10 to 12 times, moving from the upper to lower portion of the zone. Massaging this zone will help people with headaches and those also who have high blood pressure, stroke, dizziness, insomnia, and bad vision. Tai Chi has shown a decrease in tension headaches, and that's through the changes in mental focus, breathing, coordination, and relaxation offered in Tai Chi. It has also been shown that gentle yoga postures and breathing techniques may ease the intensity and frequency of headaches. The evidence for most of the physical therapies fall under a rating of C, meaning there is unclear scientific evidence, whereas chiropractic manipulations actually have the most positive evidence of B. Remember, as far as safety, although this may work for some, there may be physical limitations or other complications from these physical manipulations, so be careful when trying these at home.
Hypnosis, guided imagery, and meditation are all forms of mental stimulation that have been researched for their potential benefits in the relief of headaches. Hypnotherapy utilizes the power of suggestion to sway an individual into a deep, relaxed state. Several studies report improvements in severity and frequency of tension headaches following several weekly hypnosis sessions. A number of effects on the body have been associated with hypnosis, including changes in heart rate, blood pressure, body temperature, and the brain's alpha wave patterns. These changes are suspected to contribute to headache relief. Guided imagery is another technique used for achieving a deep state of relaxation. Practitioners utilize touch, smell, sight, and sound to achieve a tranquil state by decreasing negative physical symptoms. Initial research suggests that guided imagery may provide additional benefits when used at the same time as standard medical care for migraines or tension headaches. Meditation is defined as a state of relaxation in which an individual aims to achieve a temporary suspension of thought or consciousness. Research surrounding meditation generally supports this practice as contributing to a reduction in stress and pain in a variety of medical conditions. It has been suggested that meditation achieves this effect through the reduction of activity of the sympathetic nervous system, resulting in a lower heart rate and blood pressure, slowed breathing, and muscle relaxation. As you can see, each of these types of mental stimulation have varying degrees of evidence to support their use. While these techniques still need to be further evaluated, they have been studied in various patient populations with considerable success, particularly when used as adjunct therapy. Furthermore, mental stimulation provides the major advantage of being safe to use in most patient populations, with no serious adverse events reported in the literature.
As I'm sure you know, there are many different types of headaches. These can include tension-type headaches, cluster headaches, menstrual headaches, migraine headaches, and secondary headaches. There are actually quite a few different types of medication to treat both tension-type headaches and migraine headaches. Some of these are used more for acute relief, while others are used for prevention. With so many options, the question really is why we as healthcare providers might not consider medications to be adequate in the prevention and treatment of headaches. Some reasons to consider is that we as pharmacists know that drugs are not benign. Even the medications that many patients consider to be harmless can have serious consequences from their use. For example, acetaminophen, if you take 3 to 4 extra strength every 3 to 4 hours, can cause serious hepatotoxicity. Another concern that we have is the overuse of medications, either for the prevention or treatment of headaches, which can ultimately cause rebound headaches. A second important question is why patients may prefer CAM to traditional medical options. One reason may be an actual or perceived lack of efficacy of traditional therapy, either with relief or prevention of headaches. A second concern for patients is cost, which includes the cost of medication, physician visits, and indirect costs like side effects. Some patients fear side effects or the long-term effect of taking a chronic medication. Some patients are reluctant to take a medication every day and may fear medication dependence. This can be a particular concern for parents who are worried about the effect of daily medication on their child's growth and development. There are an increased number of patients who would prefer to control their health with natural methods like herbal products. And finally, some patients may feel more empowered by learning a CAM strategy like a relaxation technique, while others may feel that they should do everything possible to avoid taking a chronic medication. Headache treatment is an area that is extremely well suited for the integration of complementary and alternative medicine strategies into traditional care, and these strategies have actually already been incorporated into traditional treatment algorithms in many cases. Some strategies already included in the evidence-based guidelines for migraine headache put out by the American Academy of Neurology include nutritional considerations like the elimination of trigger foods and learning how to use relaxation techniques for the prevention of migraines. CAM strategies can likely be used not just for migraine prevention, but to help prevent many different types of headaches. This can help patients avoid medication overuse and subsequent rebound headaches. CAM strategies can also help empower patients and make them feel more in control of their own health, and may ultimately provide them with better headache control. With patients for whom the benefit of trying a CAM therapy outweighed the risks, we can help encourage them by explaining how CAM strategies can be used to enhance headache control in combination with, rather than as a replacement for traditional options.
Thank you, pharmacist. I feel much better now.